Hi, Laura here from Lara Johnson Physical Therapy and Wellness. And today I want to show you some stretches that I give a lot of my patients for back pain, anything related to that. And that also extends to knee problems, hip problems, ankle, foot. A lot comes from our posture and how our body is, how pliable it is, how we can keep it out of stiffness. So the reason we want to keep our body pliable and not stiff or shortened or restricted in any way is because then we have more flexibility and function to not only do our daily activities like picking things up off the floor, carrying items in, getting in and out of bed, all those things with a feeling of wellness and health and pliability, so the body feels very loose and pliable. But also then if we take it to other activities we enjoy, like walking or hiking or running or biking or swimming, or even harder efforts for my athletes out there, then we also need to keep things pliable, especially then because we do so much contracting of muscle. So we need muscles to not only contract, but also relax and expand. And not only contract and shorten and contract and lengthen, but also relax and expand. So if we lose that ability to relax and expand, then the muscles get stiffer and tighter. They stiffen up the joints that they're crossing. So muscles cross joints and get stiffer, and then pressures on the joints, and we wind up with other issues where there's pressure and compression, and that kind of friction and compression tends to lead to injuries too. So a lot of things that can be addressed with some really simple stretches and moves that you can do really easily, incorporate into your day, and make it a habit, just like brushing your teeth. It takes a couple minutes. So what this looks like, this is a standing series, so that when you're not have to get on the floor, you don't need any special equipment. So try these things. The first is standing right and left. I'll step back and show this. So standing for the front side of the body and then leaning over for the back side of the body. So it looks like this, and then I'll stand back. So you're going to take a doorway or a ledge, something to balance on, so it's not a balancing exercise, and just hook your foot backward on the carpet or the floor, and then relax the front side. The reason why this is important is because we have a ton of hip flexion. So when we're sitting, when we're slouching, when we're moving forward, even running, biking, swimming, everything's moving forward, we shorten everything on the front side. So we have a lot of hip flexion, we have very little hip extension, we don't need a lot of hip extension. So we just relax here, relax the muscles on the front side of the body, feel into that, be nice and upright, and then if you feel any stiffness or pain in that hip or back or anywhere, then just gently, so subtly adjust that leg to move it forward. So you're moving out of the stretch. Rather than pulling in, you move away so it's more comfortable. So do that for 25 seconds, then the other side for 25 seconds. And then the third one, we do right and left and front and back, is to lean over. Even better if you have a surface to lean over on, like so. Okay. And what you want to do is lean back so that you start to feel, you may feel your legs or your back, and then come forward till you don't. So it looks like this. Find that place where you feel it, and then come forward till you don't feel it. And then the hip stretch, you're hooking your foot on the carpet, letting this relax, adjusting out of it if needed. The really important piece here is to make sure it's comfortable. So you don't want to overstretch or push through or make it more uncomfortable. So you're always pulling out of the stretch to make it more comfortable. This is different from the way we all were trained to stretch and the way we've all been taught in the past. So give it a try, see how it works for you. Biggest part is feeling into your body what it actually feels like right now, not what you think it feels like and not what it felt like yesterday and not what it should be like or how far you should go, but just let that muscle relax. We have to train it to relax again, especially if it's been stiff for a long time. If we pull on it, it's going to be a counter force and pull back, which is resistance, which is more like exercise. So then we're trying to balance exercise with exercise instead of exercise with resting length of a muscle. Get it? Let me know if you have any questions. If you want to find out more, please visit my website at www.bouldercoloradophysicaltherapy.com or find me searching for Lara Johnson Physical Therapy in Boulder, Colorado. Thank you so much for watching. Have a great day.